Welcome. I hope your great day is continuing. In this presentation, we're going to be discussing tetracyclines. Here are the objectives for this presentation. I am very surprised with the indications for doxycycline especially. Tetracyclines are among the most widely prescribed antibacterial agents. They're used to treat a wide variety of infections, both minor and serious. Tetracyclines have been around since the 1940s. However, their efficacy has gone into decline due to the ever-present threat of resistance. Nonetheless, they remain a commonly prescribed antibacterial group for a wide variety of infections. In the United States, there are 4 tetracyclines available for systemic therapy. All 4, tetracycline, demiclocycline, doxycycline, and minocycline, are similar in structure, antimicrobial actions, and adverse effects. Ultimate elimination of short and intermediate acting tetracyclines is in the urine, largely as an unchanged drug. Because these agents undergo renal elimination, they can accumulate to toxic levels if the kidneys fail. Consequently, tetracycline and demiclocycline should not be given to patients with significant renal impairment. Personally, I have never prescribed the first 2, only doxycycline and minocycline. The tetracyclines are broad-spectrum antibiotics, active against a wide variety of gram-positive and gram-negative bacteria. Because of resistance, and because antibiotics with greater selectivity and less toxicity are now available, use of tetracyclines has declined. Today, tetracyclines are not usually the drugs of first choice. Disorders for which they are first-line drugs are listed here: rickettsial diseases, chlamydia, brucellosis, cholera, atypical pneumonia, Lyme disease, anthrax, H. pylori, and acne. Tetracyclines are protein synthesis inhibitors. More specifically, tetracyclines prevent the binding of transfer RNA to the messenger RNA ribosome complex. This prevents both the formation and elongation of the polypeptide chain, a process they inhibit at the 30S ribosomal subunit. This process is bacteriostatic in effect, meaning that tetracyclines prevent further bacterial growth. This helps the body overcome the bacterial infection and kill it off. Most resistance occurs through the formation of efflux pumps. With the efflux pump, bacteria can pump out tetracyclines from the cell. Enzymatic inactivation also occurs, though this is much rarer. A third method, namely ribosomal protection, can also take place, where bacteria prevent tetracyclines from binding to the ribosomal subunit. Tetracycline antibacterials are associated with their own range of potential side effects. Common side effects include: there's an increased risk of sunburn. Advise patients to avoid prolonged exposure to sunlight, wear protective clothing, and apply a sunscreen to exposed skin. Gastrointestinal effects include esophageal irritation, cramps, nausea, bowel upset, diarrhea. These reactions can be reduced by giving tetracyclines with meals, although food may decrease absorption. Occasionally, tetracyclines can cause esophageal ulceration, so they shouldn't be taken right before bedtime. Tetracyclines can cause superinfections that include C. diff and Candida. The Candida fungus may occur in the mouth, pharynx, vagina, and bowel. Tetracyclines cause staining of the deciduous teeth of the infant if taken during pregnancy, but not affect the permanent teeth. Discoloration of permanent teeth occurs when the tetracyclines are taken by patients aged 4 months to 8 years, when tooth enamel is being formed. Tetracyclines are thus contraindicated in pregnancy and children. Hypersensitivity reactions are rare. When we talk about the clinical pharmacology of tetracyclines, we need to think about the following factors. Tetracyclines, due to the risk of teeth discoloration, are contraindicated in pregnant or lactating women and in children with developing teeth. As a rule, oral tetracyclines should be taken on an empty stomach 1 hour before meals or 2 hours after, and with a full glass of water. An interval of at least 2 hours should separate tetracycline ingestion and ingestion of products that can chelate these drugs, such as milk, calcium or iron supplements, and antacids. Tetracyclines may worsen the symptoms in patients with myasthenia gravis. By killing colonic gut flora, which otherwise produces vitamin K, tetracyclines enhance the anticoagulant effect of warfarin. They also interact with other drugs. Though tetracycline resistance has increased in recent years, they remain an important drug class for the treatment of a wide variety of infections.